Hi, I am Dr. Mutyalata, Consultant Obstetrician and Gynecologist, Motherhood Hospital, Hebbal. Today I am going to talk about a very common topic, that is irregular periods. This is a very common condition seen in all age groups, and most of the men face this issue at some point in their life. So what are irregular periods, and do we really have to worry? A woman is said to have irregular periods if the length of her menstrual cycle keeps changing. That is, the gap between her periods keeps changing. On an average, the length of her menstrual cycle ranges from 28 to 32 days, although it's normal for it to be a bit shorter or longer than this. So if you have less than 21 days cycles, or your cycles are more than 35 days, then this is not normal. These are irregular periods and need to be evaluated. What are the causes for irregular periods? So throughout a woman's life, she undergoes many hormonal changes, and because of these hormonal changes, there are some phases in her normal life where she has to experience these irregular periods. For example, during puberty, 1 to 2 years following her puberty, a girl can experience irregular periods because the period axis is still immature at that time. Likewise, during pregnancy, a patient will not have a period, and some pregnancy related issues like early pregnancy failure, early abortions or ectopic pregnancies, these patients can have missed period followed by irregular bleeding PV or spotting PV. So these conditions have to be evaluated. And again, following childbirth, following abortion, during breastfeeding, and the perimenopausal transition, that is 1 to 5 years before the actual menopause, and during menopause also, it's quite normal for these women to have irregular periods because of the hormonal changes. Again, excessive weight gain due to lack of physical activity or unhealthy eating habits can cause irregular periods. On the other hand, excessive weight loss because of eating disorders or doing too much of exercise can also alter your periods. Stress is one important reason why a woman can have irregular periods. Currently, life is very stressful for most of us because of the work related issues or because of the changes in the lifestyle. Because the menstruation axis is directly related to the brain, any stress related issues can alter your periods. You may be suffering from some hormonal disorders, the most common of which is the polycystic ovarian disease or the polycystic ovarian syndrome. So this is a condition where your ovaries are studded with fluid filled sacs. These sacs are nothing but premature ovarian follicles which does not have the capacity to ovulate. So these patients will not ovulate, or they have delayed ovulation, as well as they have delayed menstruation or no menstruation at all. So if we see, 80 to 85% of the patients with irregular cycles can have PCOD. You may be having some thyroid abnormalities. So excessive thyroid hormone levels in your blood or very low thyroid hormone levels in your blood can alter your periods. Again, 40 to 45% of the patients with irregular cycles can have thyroid abnormalities. So one more condition, that is hyperprolactinemia. So prolactin is a hormone in your blood again which can have an impact on your periods. So you need to check for this hormone as well. So many of the times these conditions can be managed by simple lifestyle if it is not too late.